So I know we spoke about this about a year or so ago in terms of the update to the CSF data. So number one, I mean, we've known for years that NfL can be sort of used as a, maybe a prognostic biomarker. And what we were interested in the original data was, can you use this as a measure of DMT responsiveness, and can you use it as a measure of inflammatory activity? And what we show in that cohort is a slightly different cohort from the plasma sample cohort, is that one, CSF NfL goes down dramatically after approximately 6 months after relapse, as does the updated data would include IgG index. So that's something that we use, of course, in current clinical practice along with OCBs, but we show that CSF NfL and IgG index in this updated data correspond or correlate very, very well together. And what we also show to add into the mix is that all those T cell and B cell subsets, they go down dramatically after the 6 months, but they correlate perfectly, or really, really well, I should say, with both the CSF NfL and IgG index, which is the new information that we've added in. So for the CSF data, we can use that information. So, there's different laboratories or clinics, say even in Canada. I know in Ottawa they measure serum NfL. So if we can take that information and say if we use plasma samples of the NfL, or even if we did CSF NfL, and then use that information with both the IgG index and the immunophenotyping, that might give us a broader range or a breadth of information for someone who maybe isn't responding as well to the DMT. Maybe they need to do a DMT class switch, and it might show that maybe even for people who are diagnosed up front that they have high inflammatory activity, so maybe we need to hit them harder with a highly efficacious DMT right up front as opposed to anything else.